Good morning. My name's Janet Edwards, and I'm here to share my daughter's story with you. This is my daughter, Nikki. I've been a nurse for over 30 years, and I'm currently working for Magellan Healthcare, and I'm the senior clinical director for their chronic pain program, and we are currently developing an opioid program. So, I'm blessed to be able to, have the opportunity for that position to be able to, help people who have an addiction. So this is my daughter, Nikki. She died 3 years ago, June 13th, and she died from an accidental overdose of fentanyl. And she was a nurse, and she worked here at IU Health. So this doesn't look like a person who's suffering from addiction, does it? This picture was taken 3 months before she died. So what we see today is very different than what we used to see, 10 years ago. Addiction is hitting everybody, all walks of life. And the statistics are that 1 in every 10 nurse will suffer from addiction. So Nikki grew up in Terre Haute, and she was a cheerleader. She played volleyball, she played basketball, and had a normal, upbringing. She went to Indiana State University to get her nursing degree, and while she was there, she got pregnant and had this little guy that you see here in these pictures. So she did take 1 year off and then went back to school and completed her bachelor's degree in nursing. And Nikki was very driven, and so I like, coming here and hearing them talk to you about self-care and how important it is, because I think that might have been missing, from her life. But she was very, very driven. She worked. She took 16 hours at school. She raised, a son, and she was a single mom, and she made great grades, pushed herself, up, long hours working on care plans and studying for tests. And I don't think that she took the time, to take care, of herself. So she, I did not know this at the time, but she was taking Adderall, Ritalin, Xanax, which she could get from any physician. And I believe that this is where, her addiction may have started. So addiction, can start from, prescription medications. It can start from possibly somebody that's had an injury. And, nurses are prone to injuries, especially back injuries. And you start, on prescription medication, and then you become addicted. So that was not the case for Nikki. Nikki started with prescription drugs to help her get through school and to help her anxiety. Like I said, I did not know that she was doing that, at the time. So she graduated with very good grades, and she did her capstone here at IU Health, and then Nikki and Colton moved here to Indianapolis, and she did accept a job here, and she was in a critical care area. So, there was a lot of pressure. She was a new nurse in a, highly stressful unit. And she started out on nights, worked 12-hour shifts, single mom, taking care of her son. So 11 months before she died, she called me and said that she was addicted to heroin. And I could not believe it. I mean, I could not understand how somebody, intelligent, beautiful, a great mom, a good nurse, could be addicted, to heroin and, shooting it up, with a needle. And so, I was devastated. She sat at my kitchen table and just sobbed because she didn't know how she got there. And she didn't want to be there. But she refused to get help. She was full of shame and guilt, and she was afraid to get help because she was afraid that they were going to tell, her boss. She was afraid of losing her job. She was afraid of her peers looking at her, in a negative way. She was afraid of, her son being taken away from her. And so she thought that she would just try to take care of this herself. She swore me to secrecy, and so I lived with the whole thing in silence. Her father was the only other person that knew, and looking back, that is something that that I would do different and that I can share with other people to do differently. But she said that she got clean on her own, and I believed it because I wanted to believe it. And denial, I lived in denial. In the beginning, before I knew that she had an addiction, there were signs there, but I justified them by, working 12-hour shifts, being a single mom. She was exhausted. I kept trying to tell her, go to the doctor. You need to get, into a doctor and get a physical. She was vomiting. She was jittery sometimes, really sleepy other times. And all of those were symptoms of withdrawal. So I didn't know it at the time. After she told me that she had the addiction, then I fell into the denial where I saw symptoms still, but I wanted everything to be okay. So, she told me that, she was clean, that she was, not taking any drugs. And so, that's what I believed. So on June 11th of 2014, I was at work and I received a phone call, and it was a friend of hers saying that she had been rushed to the hospital and she wasn't breathing. So that's all I knew. And so I get in the car, and she was in Terre Haute, and I drove to the emergency room, and I go into the emergency room, and they had her in an ice bath, and she was totally unresponsive, was not responding to any kind of stimulation, and she was under no sedation. I looked at her laying in that bed, and I knew that she wasn't with us anymore. So, of course, she was on a ventilator. They admitted her. All the drug screens were negative. There was no heroin, there was no marijuana, no Vicodin. It was negative. With her history of addiction, I knew that it had to be something, but I just really couldn't figure out what it was. And so they never did find out while she was in the hospital. So when they did the autopsy 6 weeks later, we found out that it was an overdose from fentanyl. But when she was in the hospital, her brain herniated. And so we knew at that point that there was no chance at life. So she drove to Terre Haute that morning, and her and Colton, she was taking Colton to her dad's because she had to work the next 3 days. Went to her friend's apartment, and he was also a nurse, and they were up on, I think, the 3rd floor, and they went out to the little balcony on the apartment complex, and she started turning blue, and she quit breathing, fell to the ground. He was doing CPR. He never called 911. So she went a very long time without oxygen to her brain. Her 6-year-old son was there and witnessed the entire situation. And so I have a recording of what he witnessed.
Yeah.
Mm-hmm. When me and Mommy were going to his house, I went inside. We were watching cartoons, and my mommy went outside. She went to the bathroom. She went out to start smoking, and all of a sudden she started turning blue, and she closed her eyes, was asking a question, and she wouldn't answer, and she fell on the floor and kept yelling in her ear to do kind of like CPR, and took her to the doctor.
He was 6 years old at that time, and he'll have to live, with that for, the rest of his life. He was in counseling for a couple of years, for PTSD, and he's doing really great. He lives with me now. It took me a year and a lot of money to get guardianship of him. And so he's really, really doing a good job. He knows what happened to his mom. We waited for a year to tell him so that he could develop some good coping skills. When we told him, and so he knows and he understands, and he wrote a little book and illustrated it, and he's ready to talk about it now. So after she died, when I went to her apartment to clean her apartment out, there was a drawer that had probably more than 50 vials of fentanyl and syringes and tourniquets. And so I knew then, even before the autopsy came back, that that it had to be fentanyl. And she was diverting it from work, and nobody knew. No, her best friend on the unit did not know, and she didn't have any absentee issues. She didn't have any issues at work, and so I don't know how long it was going on at work, but probably for some time to get that many vials. She was probably doing this for a long time. So some of the takeaways that I have, for all of you, in addition to, self-care, taking care of yourself, to know the signs and symptoms of addiction and to understand them. They're different for alcohol than they are for drugs. Alcohol is pretty easy to detect just because of the behavior and because maybe, there's alcohol in the breath. But when someone's taking drugs and they have a true addiction, it's hard to tell, because after they're addicted, they take the drug to feel normal. So they look normal, they act normal, they function normal, when they're on the drug. It's when they're trying to get off of it is when, you're going to see, the symptoms, they may be sleepy at some times, they may be, jittery at other times, vomiting, slurred speech. But some other things that you can be on the lookout for, maybe they volunteer to be the ones to, give all the medications all the time. Maybe they stay after their shift or come in early. Maybe their patients are experiencing a higher level of pain, because there's many forms, of diversion. One of the other things that I encourage you to do is that make sure that you waste, sign off on waste and that you watch it. I know, just being a nurse myself, my sister's a nurse, you get busy, you're, understaffed, and, you're they're your friends and you trust each other, and so you know, nobody witnesses the signing off, you know, of the narcotics. So take the extra few minutes to do that. It's so important. The other thing I encourage is to report, you know, to your supervisor. You know, if you think that somebody is impaired, you know, it's a really hard thing to do. You know, I couldn't report my own daughter, so I know how hard it is. But for some people, you know, rock bottom is getting caught, you know, or, you know, maybe, you know, going to jail, or, you know, but for Nikki, you know, her rock bottom was death. I mean, she literally had nothing up to that point. So, you know, you really do want to be that person who, you know, reports someone that you think that might be impaired. So not only can you be saving, you know, that nurse's life, but the patient's life also. You know, we have a, you know, ethical duty as a nurse to, you know, protect our patients and to report that. So know what your facility's policies are on that, and because, you know, I've lived in silence. You know, I lived in silence for a year. My family didn't know, nobody knew, and you don't want, you know, to do that, or to live through the pain, you know, of losing a coworker, you know, or a friend.